Hello, everyone. My name is Matthew Schroth, and I will be showing you the differences and similarities in the healthcare systems with Macedonia versus the United States. All right, so let's get started here. For the population of health, the life expectancy from birth till death, this was done from statistics from WHO data published in 2008 with the life expectancy. Macedonia was at 75.7 years until 2016, and in the United States was at 78.69 years old, which is about roughly a 3-year difference. Macedonia, the male expectancy of life is at 73.8, while the female is at 78, with their world rank at 63. And the leading causes of death, their first in order goes stroke, their coronary heart disease, inflammatory heart, diabetes, and which is very surprising to have stroke at number one. And for the United States, the average male life expectancy is 76, females 81. Again, with the females living a longer life than males in both countries. The world rank is at 34, so that is nearly double of what Macedonia is. And the leading causes of death coronary heart disease, Alzheimer's, dementia, lung disease, and lung cancer. So for the next one, okay, so now the healthcare spending, out-of-pocket spending here for both countries. From a study done by the World Health Organization Global Health Expenditure database, a study done from 2000 to 2015 comparing Macedonia and the United States out-of-pocket expenses. Here you can see Macedonia. The citizens have both free healthcare and private healthcare. Under the public healthcare system, everyone is entitled to, by law, to access healthcare. But however, it is mandatory that both the employees and employers contribute into the fund. The employees are required to pay a 0.5% of their gross salary for insurance. Now, the citizens can choose to get private health care, and it's by far better because the hospitals vary. The public health hospitals would have to share a room with more than 3 people in it and can cause longer time to be treated. The private insured patients would get no more than a double room. So the private insured patients would have to pay full price for their medicine and up to a 20% copay for their prescription. For the United States here, a study done by Health Affairs of the out-of-pocket spending done in the United States was totaled to 306.2 billion in 2010 and has only increased into the trillions today. The United States does not offer free health care and has left millions of people uninsured, causing great problems in our society. Okay, on to the next slide. Okay, now on to the healthcare systems, stroke care. The number one cause of death in Macedonia is stroke. Stroke is the number one cause there, like I said, and it's a very simple recovery process. But however, it takes a great deal of work for recovery. A stroke is a clinical syndrome that is acute loss of brain function and lasts more than 24 hours and can lead to death. The percentage of those treated with medicine within a 3-hour period is a staggering 53%. A stroke is very common in post-war countries like Macedonia, and that is why it is so common there. They cannot receive the proper treatment due to how long the rehab process takes, and since they have to treat many other patients at the same time. And in the United States over here, the percentage of those treated with medicine within a 3-hour period in the U.S. is at a high of 87%. The reason being is not higher is that due to how many uninsured or unable to receive this kind of treatment. So that again is a huge problem in the United States with receiving no free healthcare. Okay. All right. Now on to the public and health prevention, sexually transmitted disease prevention and control efforts. Now, the both the United States and Macedonia have very similar ways to go about these preventative efforts for STDs. They encourage the practice of safe sex through condoms, and to not have sexual encounters with strangers. They both give out vaccines for certain types of STIs and STDs and bring about this. And also, if you suspect to have an STD, it is encouraged to visit a healthcare provider immediately to inform all of your sex partners to do the same. All right, on to the next slide, the physical environment of the safe neighborhoods. Macedonia has been addressed by the U.S. Department of State as being a level 1 country, which means to exercise normal precautions. Like anywhere else, it has troubles but can easily be avoided. Most of their crimes are like petty pickpocketing, and it is best to stay in well-lit areas with plenty of people around. Now, for the United States, it is considered the 51st safest country in America, and that is no secret that we are known for our gun violence. Major cities in the United States are known for statistically having higher crime rates. However, the U.S. is being worldly criticized for having one of the highest crime rates in the world because of this gun violence. All right. Okay, now on to access to care. The uninsured adults from ages 18 to 64 in both countries. Here you could see a chart that was done from 1997 up until 2018. Um, so the United States has had its record low in uninsured civilians to 12.5%, despite the Trump administration to underline the Affordable Care Act. And this chart here just shows how far it has decreased since 1997, and still down to 12.5 here. It's still far too low, but it is a record low for the United States, so it's a huge accomplishment for us. And for Macedonia, however, although it has free health care and can choose their private health care as well, um, it also covers most services. But due to the amount of not uninsured, I'm sorry, due to the great cost of giving lots of people the healthcare services, it is kind of overstaggered and doesn't necessarily give the best sorts of treatment in order for them to get the proper medication and care. All right. Now for the social and economic environment unemployment rates here, Macedonia is at a staggering 25.5% unemployment rate and from 2015, but has decreased from July 2018 to 21.1%. The United States has had a 4.1 unemployment rate as of March 2018, and since then has decreased since September to 3.7%, which is huge. All right. Now, in conclusion, with the comparisons between Macedonia and the United States, the life expectancy of the United States is roughly 3 years than Macedonians. The out-of-pocket spending in Macedonia is greatly cheaper than the United States. The U.S. has much better stroke care than Macedonia. Both provide the safe type of STD prevention and control efforts. They both also have very different physical environments with safety, as Macedonia is dealt with petty crimes compared to the United States, which is known for its gun violence. The United States has a higher percentage of uninsured civilians ages from 18 to 64 years old because it is not free like Macedonians, and the unemployment rate is drastically in the United States' favor due to Macedonia having a staggering one-third of their population being poor. Thank you all for watching, and that is the comparisons between Macedonia and the United States health